Welcome, you're watching Times Now Live, and we're getting unfortunate news coming in from Odisha just hours after he was shot dead by a man in uniform. Odisha Health Minister Naba Kisore has succumbed to his injuries. He's passed away at the age of 61 after being shot at by a police officer. An ASI who used his service revolver to fire 2 rounds at the minister. He sustained 2 bullet injuries to his chest. He was airlifted later to Bhubaneswar, where he's now said to have succumbed to his injuries. Unfortunate news coming in from Odisha. That's the latest that we can tell you. Remember, earlier in the day, around 12:30, he was on his way to inaugurate one of the BJD offices when Naba Kisore was shot at by an assistant sub-inspector. Gopal Das, the accused, has now been nabbed. The police has been interrogating him. Meanwhile, even as the motive behind the shooting remains unclear, Gopal Das, the accused ASI's wife, had come out to say that her husband suffered from mental disorder for the last 7 to 8 years. The police are still interrogating the accused, but in the meantime, unfortunate news coming in right now that Naba Kisore is no more, having succumbed to his injuries that were sustained after he was shot at by a man in uniform using his service revolver. The images on the left-hand side of your screen right now of the moment after the shooting had happened. You can see the minister taking bullet shots directly to his chest. He was said to be critical. Even in the preliminary reports that had emerged after the incident, the chances of his survival were being pinned at very low. Vivek Karindalam is now joining us for more details. Yes, Vivek, what can you tell us?
Yes, after 7 hours of struggle by the doctors at the Apollo hospitals, that finally Naba Kisore has succumbed. Naba Kisore has succumbed to injuries. What we understand from the press release is that on operating, it was found a single bullet had entered and exited the body, injuring the heart and left lung and causing massive internal bleeding and injury. Now the injuries were repaired and steps were taken to improve the pumping of the heart. However, he was given urgent ICU care, but despite the best efforts to be revived, he has succumbed to injuries. So shocking news that's coming in. Remember, he was shot at exactly at 12:30 today, and then he was taken to the hospital. Initially, he was taken to Government Hospital, and then he was airlifted and taken to Apollo Hospital, where he was under treatment. An ASI is the main accused in this particular case, and we also understand that he was suffering from bipolar disorder. The doctor who spoke to the media, Dr. Chandrasekhar Tripathi, the HOD of Psychiatry, MKCG Medical College in Berhampur, said that Gopal Das is a psychiatric patient and was suffering from bipolar disorder for the last 6 to 7 years. And they're not sure whether he was taking his medicines regularly. But she said, what is the motive behind the attack? Why did he shoot him? These are things that the vigilance and the police is right now investigating. Only after investigation that you will get a clear picture of what was his intention. Was there any other issue, or was he being pressurized? Was there some other external forces behind him? All those things needs to be investigated. But as of now, the shocking and sad news coming from Odisha that Naba Kisore is no more, and he has succumbed to the injuries, and the press release of Apollo Hospital has explained everything.
Right.